So, first up, what is a healthcare directory? And I will take suggestions from the audience. So, does anyone want to throw a guess at what they think a healthcare directory is? How good is that directory data? So, we did a bit of investigation. So, one of the products my company sells is a live directory service. And we took a sample of 10,000 entries in a directory and had a look at that and said, well, how good is the data in your existing system? And so there was this 9,600 in there, and we found that there was 5% of them were duplicates. So out of internal existing data that they thought that they were relying on in production every day, had 5% of duplicates that they weren't aware of. Within those, so the provider directory has identifiers which they use for secure messaging and doing lab results. And they found there was 9% of those were duplicates. So there's a bit of an issue there. On the good parts, they found they had good quality first name and last name. So there was good information in there. But then they started wandering through and checking out to find what are these other sets of data that were actually valid or invalid. So there's quite a bit. So we took that data and then, well, let's use a reference set that we know is good and compare to this internal set. And so with that, we found there was a whole single record that we could update the provider number. So that's sort of pretty low. There were 3,000 of that 9,000 that weren't in the central directory. So you have to look at that and think, well, why is that the case? Are they people that are not registered? So do I have staff that are working that aren't registered with a registration authority? So you start looking at it and thinking, what's the quality here? So do we need to move on? So that's a bit about the quality of the data. But what are directories? In the enterprise, but we're not the only ones. So there's other enterprises, and they have their own directory. And within those enterprises, there's multiple organisations. So you might be through acquisition or whatever. And then following on from that, each of those organisations, and they've all got their own internal directories. So that's sort of the organisational view. But then when I look up, some of these applications are shared across organisations. So cloud services. So there's an opportunity that data might be shared there. So it's not always just your data. And even at the organisational level. Then we look up to our parent directories. We've got registration authorities that handle the registrations. Secure messaging, so in a protocol for exchanging messages between hospitals. So there's an endpoint directory for direct addresses. And then we hopefully, at some point, get national registration bodies. So in the US, it's more likely to be a regional set, which is state-based or a subset of the state where you can get at that information. And then certification bodies like the Medical Registration Board and the likes of those. So that's the little space that I work in, sort of that area. And I guess, so based on that, we've sort of had a bit of a look and seen that there's organisational or institutional directories, service provision data structure, so organisational structure, so HR, legal, enterprise, where you've got localised content, it's not just national content, enterprise level, national, regional, yellow pages, registration or certification, you're not really searching, you're sort of doing a lookup to find those content. Terminology services is a weird one to throw in there. Why would I have terminology services in a directory space?
I'm going to do searching and say I want to find cardiologists, then I really need to know how do I express cardiologists to actually get a sensible result out of searching the directory. Do I mean cardiologists, children, or which different varieties? I can use terminology to facilitate that. So if I look in my solution application directories, you've got internal information, you've got your black book. These are my certain providers, the ones I always refer to, or I need for reporting, and then there's external information. Directories are really not a thing by themselves. We don't have a directory because we want a directory, and we have to have a directory. We need the directory to support other things. It's not there just for itself. So it supports referring, prescribing, appointments, human resources, payroll, so not just the clinical side of the business, the billing side of the business, and staff management. So all of that. So, and not just internal and external. So we always get that mix. So I thought a quick comparison between provider directory and services directory. People familiar with both terms? So who has a provider directory internally? Yep, I'd say just about everyone. Anyone has a services directory? Sure, at least one, that's good. So the real difference there is a lot of people think of the directory as your org structure, so a nice big tree and it's all clean and perfect, but the world's not like that. They're very good if you know who the practitioner is you're looking for, but if you don't, so if I want to go and find where's the nearest pharmacy, because I need to go and get some emergency diabetes medication because I've run out or I've lost it, provider directory is not much good. I need a services directory that's actually going to go and tell me I don't care who the pharmacy is or who the pharmacist is, I care about the service that I'm going to get. So that's the real big variation there. So, what makes a successful directory? Accurate. Yeah, I think we are all current. We need the appropriate breadth of content. We need the relevant terminology for how we're going to use it. It needs to be accessible. So from a technology standpoint, from a security standpoint, convenience, form factor, is it the right terminology? So if it's being used for patient access to go and find the pharmacy, it needs to be a patient-friendly terminology. If it's being for a physician, you want to have that appropriate one. Minimal technical barriers, petitioning. Is there any others that people can think of that they would like to see in a successful directory? I think one of the key points there with accurate and current and breadth is actually knowing that you've got duplicates dealt with. Do you have the current information? Are they expired? Are they stale? Is the clinic actually closed down? Have they updated their fax number? So all of that side of things. So in preparing for this presentation, I grabbed the NPES data. So how many people know what the NPES? Yep, so that's a national provider service here in the US. Yep, so Eric, he's even seen that. So it's got a pretty large set, about 6 million providers are registered in it, 1.5 million sole proprietors. It's got duplicate rows in it. So which I was actually stunned when I went and had a quick look in the whole half hour that I spent wandering through it. It's got a bucket load of stale data that hasn't been touched since about 2007. I believe it's a CSV file and does have some issues in how they produce it. So it's a fair sort of thing. It's got quality issues. So I don't know what the process is about fixing those things up, but it's just a warning that all directories have issues. Even the ones that you think are good will probably have issues. So be aware of that. So using directories in an organisation. So typical problems. So who actually is working in the developing organisational software. So a couple. Provider side, actually working for a hospital or a health service. Yeah, a couple. Writing consumer apps. Yeah. And it's 9 a.m. and I've just had to go to a session somewhere. So typical sort of problems is managing multiple systems. So from that big tree we saw at the front, which was really a representation of where all the data is, we need to manage all of that data and our view and our appropriate part of that. So actually pulling the right content out of the right system and bringing it through. So there's a lot of issues there. Maybe I'll just skip through, but really talks about the reducing the overheads. So if you manage your directory properly, you'll actually get the benefits. It's hard to really put numbers on the cost of a directory, but you can actually do it. So a lot of the cost in the directory can be indirect that you never actually think about. It's not something you get paid for. It's something that costs you money if you don't do it right. So if you don't have your claim data right because you don't have the right provider number, you might not get reimbursed for the insurance company or from Medicare, all of that. So what is the cost of that provider data? So how long does it take to find that information? So when you're actually sitting with the patient and he's come in at the check-in time and you're going through the pre-admission process, and he goes, oh, what's your usual GP? He goes, oh, I think it's this guy. Do you know what the address is? No, I know it's somewhere here. And so they go and look it up. And so to actually get that accurate information so they can send the discharge summary, it's going to take more time. And I know some of the places we've gone to is that they end up wandering out to Google, using Google, finding the address, and who knows who's updated that information. So if that clinic went out of business, no one tells Google that that's not up to date. So we can end up doing all of that. And so obviously issues of that is the patient outcomes can be affected because the right results didn't get to the right person, and potentially liability, which is always an interesting one. So that was a brief primer on directories. So sort of about why. So I now got more into the meat on what does FHIR do with directories rather than just overview. Was there any of these topics specifically that people really wanted to hear about? I've come here and I'm busting to know how to do bulk data. That's what I think about in the morning. I get up and go, bulk data today, yes. All right, well, I'll just wander down through. If you want to jump forward or back at any point, we can cover bits and pieces. So, it started off in DSTU1 where we had organization and a practitioner. The world was great. But we discovered you couldn't go and look for a pharmacy because I needed to know about the practitioner. So DSTU came along and we added healthcare services, and practitioner roles were sort of there as well. STU3 rolled around and practitioner role grew up, became its own resource, so you could actually go and find that Dr. Smith works on Mondays and Tuesdays at the East Clinic, and on Thursdays and Fridays he works at the West Clinic. So it's that recognition that those two things are separate. And then endpoint, so we discovered we want to put the direct address somewhere, and we're not just the direct address, but we wanted to add the V2 messaging address and the other FHIR servers and other services, so that tells you where they are. And that sort of links up to basically everything. So because you want to know what's the endpoint I need to talk to. And then R4 came along and we added a few more resources. So we're sort of filling out that space. So we had organisations could link with organisations, but we discovered that we need more than just the internal organisation structure we need to have the relationships between organisations. So we added organisation affiliations. And so networks, and in fact, that slide's a little bit wrong. So networks are not a profile on consent, they're a profile on organisation, but I'll correct that for the slides that are saved. Verification results, restrictions, and I can't put all these lines on. It's just going to get this big spaghetti of lines. So I sort of gave up putting the lines in. But directories support all these other businesses. So they hook into scheduling, they hook into referrals, care planning, questionnaires, the list goes on. So I won't talk in too much detail, but each of these, so I've prepared another image for each of the specific relationships. So practitioner roles sort of mesh into the locations, organisations, practitioners, so that they become the centre of the world for that role. And so a lot of the clinical use cases look at the practitioner role and give that context. So organisation affiliations, so that's the HI. Is this organisation a member of this HIE or a professional body? Is this particular organisation providing services to that particular organisation? Yep. And is that within the context of a specific network? And what are the insurance details? And is it covered within a specific coverage area? And then we have the network and insurance plan, which is the last part that's been added most recently, which sort of gives you a capacity for creating a directory of these are the insurance products. So from a consumer perspective, you could go and browse and find and communicate out the insurance plan information. So it's not a specific patient's insurance plan, it's the general, this is the plans provided by that service or organisation, so you can get a general feel. So think about a way of sharing that. So directory resources. So this is sort of another categorisation of those resources in there. So the individuals, places, the relationships, the services, so we've only got healthcare service in that space, miscellaneous, so insurance plans, verification, provenance, and then the structural side, so how that stuff, yep.
You made reference to it earlier, the organizational specific stuff, so like where would you shove the identities, like their security identity, their AD identity, their organization specific employee number, like that kind of stuff?
Yep. So there's, in each of the FHIR resources, or almost everyone, there's an identifiers collection. So, and within that, you would have your national identifiers, you might have organisational identifiers. It's not an MRN for a practitioner, but it's the same sort of concept, so employee IDs. So that stuff you can put into those. So they'll exist in the practitioner, organisation and location. As far as the security side, I won't touch on any of that, but essentially FHIR leaves the security outside so that you can use the information that's inside FHIR to inform your security model. So you might allocate into it. Yep, Eric? Okay, because we've got a compressed timeline, the bold ones are the ones that I thought people may not have seen these things, they're new, so I'll go into more detail. So that's what the big thick line around them is. Yeah, so apart from that, colour coding is just visual. Cool. So organisation and locational hierarchies. So this is the organisation and location have a part of, so you can create your internal tree structures. So these are pulled straight out of the spec. So you can get sort of an idea that on the left side is the organisational hierarchy. So each of the lines here is an organisational resource, and on the right is the locations. So each is an individual reference. There's no real hard and fast rules about what's right and what's wrong. A lot of people's ideas of how many levels you need is different in both cases. And in some places, you'll actually find that there's a point where you actually cross over between what's an organisational structure and what's a location structure. So a ward might be a physical part in a location, but it might also be an organisational unit. So where these things flow, there's no real structure. I guess another point there is location, instance versus kind. So an ambulance might be a generic ambulance, or it might be the specific ambulance, or it might be a general mobile clinic, or a specific clinic. Yeah, I shall wander along. So organisation affiliation. So we can see here we've got that identifier collection, so which is in there. So that's where we could put that detail. Active, period. It's really about the relationship between those two organisations. And so the code indicates the nature of that relationship, so which is another part where your terminology ties in, and it's between the two organisations. And that other list, so the section at the bottom, that's really a constrained set to say within this affiliation, these are the set which actually apply to that set. Practitioners and practitioners' role. We get a lot of questions about what's the difference between the two, why do we have the practitioner role? I guess the practitioner is the person, so the caveats, the contact details in there. So any of that information applies to everywhere that practitioner is. So if he works in two different places, you're not going to have both different places' telephone number in there. That's what the practitioner role's for. So the practitioner role has that location or that service's specific details in it. And you can also schedule at the practitioner role level. So I want to get an appointment with Dr. Smith, but I'm only interested in the East Clinic because I can't get to the West Clinic. So you can schedule from that perspective. Qualifications, so that was another little point there. So the qualifications on the practitioner, it's also suitable to put in certifications, training, registrations in there. And the validated directory guide, which I'll talk about briefly, also adds more data into that specific space. Endpoint, I sort of touched on that earlier. So that's the technical details about how to connect to another system. So think your direct endpoint address, V2 messaging, your DICOM setup, all of those things. So it's sort of about, I'm going to register in this central directory or shared directory and say, this is how I want you to communicate to that particular area. So it allows distribution. Verification result. So this is a new resource for R4. So this is, when you're talking to a central directory, this is going to be something that's really important to you. So you can look at this resource and it will tell you where did this data, who attested to it and who said that this is the correct details. Did they just pull it off Google? Did they walk down the street? When did they last get it? And how do they check? How often do they go and update it? So we can have that level of trust to know this record is not stale. So, and how did they get it? So searching, I'm not going to drive straight into all of the details. There's tons of other info out there on searching. But I'll just point out that from a directory, yeah, simple searches, a lot of people do that. Chained searching, so who's heard of chained searching? All 4 people, great, 5, 6, no. So chained searching allows you to say, I want to search organisations, but I want to check properties on a healthcare service. Or I want to search healthcare services, but I want to constrict based on information in the organisation. So it's sort of like cross-research, think of a join from a SQL perspective of what that is. Part of searching, so within the organisational hierarchy, that's still got some work to be done in the spec. I'm going to touch on the geolocation searching because I love it. and bulk data. So was there any specific questions on searching? Yeah, so it's really, because you've got that nice big organisational tree, and so I want to say, well, find me all the stuff that's relevant to this particular part of the subtree. So that's an area of the spec that we don't do very well, if at all. We have to be explicit at the moment, but we want to fix that. So that's one of the areas that it's sort of a gotcha, and I thought I'd throw that on there. So I'm going to, given time, sort of skip through a scenario where you've got a whole bunch of stuff that happens to go in to get a colonoscopy. And so I sort of would talk about what happens during this process where I'm going to use a directory. And there's two different types of searching. So I'll do searches and lookups. So what's the difference between a search and a lookup? And so I'm just wanting the details specific to that, where a search where I don't know what I'm looking for, but I need some way of narrowing down to find it. So both needs, appointments, forms, endpoints. So a practitioner looking up a known practitioner's details internal, so I want to do some secure messaging for the lookup. I've got a system that's going to pass out the discharge summary, so it needs to get the endpoint to do that transmission. A practitioner is looking for another practitioner to do a specific specialist referral. A practitioner is looking for a mental health service to go and do that. So we don't care who the practitioner is in that case. Or a consumer is looking for a search for a specific service with a set of known properties. So is it covered by my insurance? Is it open now? Is it within this region? And then availability, sort of that, another part which often mixes straight into it. So I'm going to skip federated directories unless anyone specifically has details on that. No? Good. So geospatial. This is sort of new. So the center point's been there for a long time. So you can say pin down the center point of the location. So boundary is new. So which is an extension that we stick into the location, which captures the shape of the area. So you could use it for things like a coverage area. So this location is the coverage area for this network. And so if patients fall within that, then they're eligible for services. So there's a nice sample resource. So we see location at the top. This is the Boston area. It's the extension for a boundary. Is this the first time anyone's seen an actual FHIR instance? Phew. Whew. So that nice big long string is base64 encoded, and that's a GeoJSON shape. So we picked GeoJSON because looking out there, that's what the majority of the open source components can render natively. So we picked that. It's well structured, so you can actually pull it out, throw it on a web page, job done, nice sexy shape. Good. And what else have I got there? Yep. So the URL's on there if you want to go and have a look at it yourself. So near searching. So near searching changed between 3 and 4. And within that, we can see near, here's the particular geocode coordinates, so lat long. How far away, so if I draw a circle around it, that's the size of the circle, and the units, kilometres or miles. And then you'll get back the search results, which has the locations, and how far away it is from the point you gave. So note that that distance is in the search result. It's not in the location because it's related to the search, not related to the entity. So if that all makes sense. Why we changed the format between 3 and 4. In 3 you had a near and a near distance, which was useless if you wanted to actually try and use it in chaining, which is 90% of the use cases for using it. So it sort of sucked and we fixed it. And you can also do multiples. So I can say near this or this or this or this. So you can say I've got home and work. I can provide both those points and it'll give me the services that fit. Cool. So contains is brand new. So it allows us to say, here's a point, and I want to know, is that point within the boundary of that shape? So coverage area, here's the coverage area for the organisation or that network. I can use contains, and it will say, yep, that particular location, coverage area fits that point. Really nice. And thanks to learning all the pain for near, it supports multiple as well. So you can do that. So we're basically at time, which sort of sucks because I really wanted to talk about synchronizing directories. Maybe the 2-second version. You need to choose what you're getting at, how you're going to get it, and how you're going to keep up to date. So they're the tricks. You've got choices, polling. You can provide your criteria and say, I want to get the updates since a particular point in time. That'll miss stuff as it moves out of criteria. You won't get any deletions, and you've got a poll. If you use list membership, then you can actually say anything changes with people that were within that list, and great. So we don't miss stuff with the search criteria, but we do miss stuff that were deleted, and it needs the server to understand the list. So the client has to manage that. I personally like this option because it means I can have my local black book created as a list, register in the directory, and then only get updates to what I care about. You could do polling with no search criteria and say I'll do filtering on my side, not yours, which is quite cool if you're getting basically the whole data anyway, and then that works. You could poll the history endpoint, so you'll get deletions. But once again, you're getting everything, and it's client-side filtering, and you'll get every single change, not just the most recent one. So it's sort of, yeah, you can use lists and filter the history as well, which is kind of cool. So that's another nice one. We can use subscriptions for the same sort of mechanism, but since that's based on search, you get all the same sort of side effects of stuff moving out of the constraints, or deletions don't come through. So unfortunately, all options have a trade-off. There is more work going on subscriptions, and hopefully we'll try and address some of those problems. So bulk data, I'm out of time, so I will skip bulk data export. So essentially from a directory standpoint, we're leveraging the normal bulk data spec, and the normal bulk data spec has a base dollar export, so we're leveraging that, and we're trying to add some extra bits in there to cover a little bit of the directory space more friendly. I'd be amiss to point out the validated healthcare implementation guide, FHIR. So that's a profile that's been facilitated with the ONC to capture something that they hope will be built here in the US. So actually provide a standards-based access to a system that will have that, whether that's a single, multiple, whatever. There's a workshop Thursday, Friday this week.
Yeah, Brian, on that point, the payer data exchange guide in DaVinci is taking validated healthcare directory as the base to do the member authorized sharing of the directory.
Yep. Cool. And so next round we'll be doing the US, the tight US bindings. So at the moment it's a more open international spec, but with the US requirements in mind, and the next build will more tightly define the terminologies that go with that. So that's sort of what that target architecture will look like. Primary sources, going out, getting that information, feeding it in, and then disseminating that out to your local organisational informations. It added a whole heap of new extensions, so which is supporting that particular need. And So unfortunately we started a bit late, so I had to sort of rush through the end there. So I'm hoping that that's sort of been useful and you managed to get at least 4 or 5 nuggets of information that'll help you when you get back to the office. And when you want to start coding this into your system or considering it, that you'll have a bit more information about why it's important, where the gotchas are, and some of the cool new stuff that we're working on. Yeah. I think that we've run out of time for questions, but I'll be around a couple of days. So I'll be in the coding area, so come hassle me. I'm happy to ask questions, answer questions, and look on Zulip if you've got there, so the chat.fire.org. Thank you.